Hey, it's Eric from TRUBody Fitness showing how to do a full body self-myofascial release prior to working out. First he's going to start off with the rectus femoris and quads. We're just going to show about 5 passes here. A nice slow tempo. He's going to start distally, move proximally up with the foam roller. Now he's going to move to the inner thigh, vastus medialis, a little bit of gracilis and adductus longus, all those groin muscles that cause a lot of pain and agony to a lot of people. And now I'm just going to move to the outside of the thigh, vastus lateralis, a little bit of IT band. He'll hit a little bit of glute med here, or he's going to move all the way up, pushing up hard. And if you find a trigger point or a little bit of a tough area or top band, sit on that area for a little while, let it release. You're going to feel it kind of soften on you. Okay, this one's for runners or anybody that does endurance stuff or any lot of leg work. Is going to have tight spots across this area.
Let me start fully with the bottom.
Now I'm just going to move to the stick and work out the gastrocs, a little bit of soleus, then you can move around to the other side, working the peroneals. Again, if you're a runner or any kind of person that uses high endurance, this can be a great spot to work out. Again, if you find a trigger point or a top band, sit on that spot for a little bit longer, add a little bit more pressure, and wait till that little top band softens on you. Okay, you got a little bit of Achilles tendon there. Now these sticks are great to use. You can pick them up at either our clinic or online at thestick.ca. Okay, I was going to move to the hamstrings. First we're going to do a general hamstring pass. Look at Eric's facial expression. Yeah. There you go, right, hit at that insertion at the ischial tuberosity, right where all those hamstrings come into and attach. Usually when you feel a pull hamstring, that's where you're going to feel it, or if you feel like a little bit of SI joint discomfort or sacral tuberous ligament issues, it's all going to be that spot where Eric is working right now. He's going to go more of that adductor semitendinosus, semimembranosus junction there. Tight piece of thick fascia that you should always work on, loosen it up. Now we're going to move to the tennis ball. Do a little bit of piriformis, glute med. Okay, now he's going to hit a little bit more glute med here, glute max. Now we're going to move back to the foam. We're going to move into the lower lumbar spine, thoracolumbar junction or thoracolumbar fascia. And always keep a little bit of flexion in the spine. You may hear a couple pops or cracks when you're doing this one. And you're just going to shift a little bit left, shift a little bit right to make sure you get all those fascials like erector spinae groups, paraspinal groups, and those lumbar vertebrae. Now Eric's going to move up into the thoracic spine. Now this can be done for the thoracolumbar and the thoracic mobility stuff. You got to add a little bit of a rotational component to the thoracic spine. Now this is a great area to work for any low back pain or neck pain. It's kind of that junction in the middle of the two that is always a culprit in neck, hip, low back pain. Now Eric's going to move good. Now Eric's going to move up into the lat and a little bit of the tricep right where they cross over. Watch his hand. He's going to rotate his palm up, rotate the palm down to get a full stretch in those lat and that tricep. Again, any kind of shoulder neck pain, really focus on this area. It's going to be a big culprit in neck and hip and low back pain as well. Good, now he's going to go into the pec. Office workers, anybody, everybody's got to work this muscle here. Looks kind of awkward what he's doing. Watch his hand. He's going to really rotate that hand, get the full pec to move. So he's going to stretch out the pec while adding a little bit of motion. Again, if you feel a top pin or trigger point, add a little bit more. Good. And there you got a little bit of bicep as well. Good, that's it. Perfect, that's a self-myofascial release. That's just a quick body. We're not focusing on anything there. Just should do it before and a little bit after your workout. That's just the general approach to it. Good, thank you.